Hi everyone, in this video I'll be discussing confusing drugs because when you attempt the exams there is always a confusion because some of the drugs sound similar. So let us avoid that confusion and I have listed some of the important confusing drugs and let us analyze them. So let us start the first one. The first confusion is between the drug by the name buspirone. So buspirone and a drug by the name bupropion. Now remember, buspirone is a drug which is a 5-HT1A partial agonist. So it's a 5-HT1A partial agonist and it is mainly used to treat chronic anxiety. It is used in treatment of chronic anxiety. Now you will confuse with bupropion and it is an atypical antidepressant and it is called as NDRI. So bupropion is used in depression. It's an atypical antidepressant. It is also used in management of obesity. Now remember bush, snake. It sounds like snake. Buspirone. When you see a snake, anxiety. So buspirone is for chronic anxiety. That is for anxiety conditions. Bupropion is mainly for smoking cessation, obesity, and it is an antidepressant. That is atypical antidepressant. One more drug similar to that is budesonide. Now budesonide, it is a steroid. So it is a inhalational corticosteroid. So budesonide is an inhaled corticosteroid. So we have one more drug. The name is called buprenorphine. Now buprenorphine is an opioid and it is a complex acting opioid also called as mixed acting opioid and it's a partial mu agonist and also it's a kappa antagonist. So don't make mistakes when you see this buspirone, bupropion, budesonide and buprenorphine. Yes. Now let us move on to the next one. That is the difference between clotrimazole. Clotrimazole is an antifungal drug. It's an antifungal drug. And you will confuse with a drug called cotrimoxazole. Remember, cotrimoxazole is an antibacterial drug. And also it's an anti-protozoal drug. Cotrimoxazole. Remember, it starts with CO. Co means it has two drugs. Trim stands for trimethoprim. Oxazole means it has a sulfonamide that is called sulfamethoxazole. Moving on to the other drugs, there is a name called chlorpromazine. Chlorpromazine is called as typical antipsychotic. So it's a typical antipsychotic. Now there is high chance you confuse with a drug called carbamazepine. So carbamazepine is an anti-epileptic drug. Anti-epileptic drug and the name is called carbamazepine. Then we have one more drug and the drugs are cycloserine. Cycloserine is a drug for TB. It's an anti-TB drug and there is a high chance you confuse with cyclosporin. And cyclosporin is a calcium inhibitor and is mainly a immunosuppressant. Remember cycloserine, it is also called as psychserine because it causes psychosis and seizures in a patient treated with this drug. Then another drugs, the next letter is D, duloxetine, and a drug by the name duloxetine. So duloxetine and duloxetine, remember duloxetine, it is a SSRI. And since the name has P, so it is used for P. What is the P? It is used for a penis condition that is premature ejaculation. It is used in premature ejaculation. Duloxetine, it is a SNRI. It is a SNRI, so don't make a mistake with that. Now moving on to another drug starting with a D, that is called dipyridamole. So dipyridamole is an antiplatelet drug and it is known to produce coronary steal phenomenon. And that's the reason we don't use it in prophylaxis of angina or in the management of MI. And it is only used for stroke prophylaxis. The high chance of confusion is with disopyramide. Now this drug disopyramide is a class 1A antiarrhythmic. So it's a class 1A antiarrhythmic. So avoid these confusions. Then after that, we have a drug which starts with F. The name is flumazenil. Now when you think of flumazenil, remember the ZZZ, so the sleep. So it is used as an antidote for, it's an antidote for which poison? Benzodiazepine poisoning, Z drug poisoning, and also it is an antidote for beta carbolin. And most of the times you will confuse with fomepizole. So fomepizole is an antidote for alcohol. Which alcohol poisoning? Methanol and ethylene glycol poisoning. Ethylene glycol poisoning, it is the antidote. So many a times you will confuse this. Remember, it has two O. So remember, whenever there is alcohol, then remember O. So OHO. And what is the mechanism? It inhibits alcohol dehydrogenase. Another drug is flunarizine. Flunarizine, it's a T type of calcium channel blocker and it is used for migraine prophylaxis and a drug called fluphenazine. So any drug ending with azine, they are usually typical antipsychotics. They are typical antipsychotics. Typical antipsychotics, right? Then moving on to the other aspect, the name called metronidazole. Metronidazole. Remember, it ends with nidazole, and metronidazole is mainly an anti-protozoal drug. That is for amoebiasis, trichomoniasis, vaginosis. And don't confuse with mebendazole. So mebendazole is an anti-helminthic drug. So it ends with bendazole. Then again a drug called methotrexate. I know it's simple. Methotrexate is an anti-cancer drug and it inhibits the enzyme dihydrofolate reductase. Now many times in the exam, most of your drugs end with azole. So let me give a clue for you how to differentiate these azoles. Let me take the example pantoprazole. So anything ending with prazole, usually they are PPI. They are proton pump inhibitors. But one prazole you should differentiate, that is called aripiprazole. Remember, they end with P-prazole. And P-prazoles are mainly, they are called atypical antipsychotic. And it's a atypical antipsychotic and also it has partial D2 agonism. It's a partial D2 agonist. Then remember the drug metro. The drugs end with nidazole, metronidazole, tinidazole, orinidazole, secnidazole. They end with nidazole and they're mainly anti-protozoal drugs. Then the drugs ending with conazole, for example, fluconazole. So if they end with conazole, for example, ketoconazole, voriconazole, postconazole, isoconazole, these are all antifungal drugs. Antifungal drugs. Then we have another drug, albendazole. Remember they end with bendazole, albendazole, mebendazole, triclabendazole. Remember these are all for helminth. So these are anti-helminthic drugs. Then another drugs which end with not azole. Remember all these drugs what I have taught to you, they all have azole, and I told you how to differentiate them. But there is one more drug, and the name is letrozole. It ends with not azole, it ends with ozole, and it is a aromatase inhibitor. So for that we have other drugs like ozole, anastrozole, fadrazole, orozole. They end with ozoles, right? And they are used in breast cancer. So this is how you have to differentiate the drugs ending with azole or ozoles. Then moving on to the other aspect, the drugs like topiramate. Now topiramate is mainly an anti-epileptic drug. It's an anti-epileptic drug which is also used in craving of alcohol, obesity, migraine prophylaxis. Don't confuse with tropicamide. Tropicamide is a passive mydriatic, and it is the shortest acting passive mydriatic. Shortest passive mydriatic. The name is called tropicamide. Then another confusion is between terfenadine and a drug called terbinafine. Terfenadine is a second generation antihistamine. It's a second generation antihistamine. So it blocks histamine and it is shown to produce QT prolongation. Terbinafine is an antifungal drug. It's an antifungal drug. So terbinafine. In insulin preparation also there is a confusion. What is that? Insulin, glargine, and one more insulin, glulysin. Remember glargine ends with large. So remember it is the long acting insulin. So large, it is longer acting. Glulysin, if you know it is large or acting, glulysin will be a rapid acting insulin. A rapid acting insulin, it is called glulysin. Moving on to the other aspect, there is a drug called leflunomide. Leflunomide is a immunosuppressant. And we use it in rheumatoid arthritis. It inhibits an enzyme called dihydroorotate dehydrogenase. Don't confuse with levamisole. Now, levamisole is an anti-helminthic drug. It's an anti-helminthic drug, levamisole. The last one is the confusion between trimethoprim and one more is called triamterene. Trimethoprim is an antibacterial drug. It inhibits dihydrofolate reductase. It's an antibacterial drug. Triamterene is an inhibitor of ENaC. It's a potassium sparing diuretic. So these are the confusing drugs. And one more thing I just want to add here is the drugs ending with statin. Cilastatin. So cilastatin inhibits an enzyme called dehydropeptidase. Now this enzyme is going to degrade an antibiotic called imipenem, and the imipenem is shorter acting. So what we do to make the imipenem longer acting, we add cilastatin. So why do we do that? To make the imipenem longer acting. So it's a dehydropeptidase inhibitor, cilastatin. One more drug is called pentostatin. Pentostatin, remember, it's an anti-cancer drug. It's an anti-cancer drug. And most of the times you will confuse with the commonly used statins, that is the atorvastatin. Remember them as vastatin, and these are the drugs for dyslipidemia. And what is the mechanism of action? They are HMG CoA reductase inhibitors. So these are the confusing drugs what I had to tell you, so that you don't make mistake in your exams. And that's it from this video, the confusing drugs. So avoid the confusions. Thank you all.